All right, this is part 2. We're doing a series deep diving into PCOS. So we're starting at ground zero, at the basics. If you want, you can download the workbook. It's linked in my bio, so you can follow along, make notes, and I hope you find this helpful. So we're starting at the beginning. And firstly, I just want to say that I know that there's a lot of misconceptions and myths surrounding PCOS out there. And for those of you who don't even know what PCOS is, we're going to get into that in a moment. But for some of you who have this condition, you may be experiencing some of these. So let me know if you've heard any of these or if you've ever felt any of these. Give me a number between 1 to 8. So number 1, I'll never be able to lose weight because of my PCOS. Number 2, PCOS means I'm infertile and I'll never have children. Number 3, there's no point in trying to manage my symptoms because PCOS is incurable. 4, PCOS is punishment for something I did wrong. Number 5, I should avoid all carbohydrates to manage PCOS. 6, I can't have a normal menstrual cycle with PCOS. Number 7, I have to follow an extremely restrictive diet to manage my PCOS. And number 8, I can't enjoy food or eating because of my PCOS. So let me know 1 through 8 if you have thought any of these myths before or any of these things before, if you've heard any of them before. I'm curious to know which ones or like what's the vibe. And so for those of you who don't know, and maybe for those of you who don't quite understand, PCOS is an acronym for polycystic ovarian syndrome. And really the name is a misnomer because when we talk about how we diagnose PCOS, you'll see that you actually don't need to have cysts on your ovaries in order to be diagnosed with PCOS. So the name is a little bit misplaced. There was actually a little bit of a push to get the name changed, but I do think that may actually cause even more confusion. But the term polycystic ovarian syndrome basically refers to having lots of cysts on the ovaries. And this comes from really the appearance of the ovaries of people with polycystic ovarian syndrome. Sometimes when we look on ultrasound, we can see that their ovaries have lots of little bubbles on the surface of them. Sometimes they're called string of pearls. So they have lots of these little cysts on their ovaries. But the interesting thing is that they're not actually cysts. Cysts are basically fluid-filled sacs. And really what people with PCOS have is lots of immature follicles on their ovaries. So we're going to be talking about your ovaries and normal menstrual cycle. So just in case you've never heard the term polycystic ovarian syndrome before, whenever we use the word syndrome in medicine, it's usually because there's lots of different symptoms that we kind of grouping together under the same umbrella. So for a lot of people with PCOS, yes, they will have that like cyst-like appearance on the ovaries, but some people with PCOS actually do not have cysts. But really, the syndrome is basically this umbrella term for people who are experiencing a group of symptoms. And those symptoms are related to an irregular menstrual cycle. So usually people with polycystic ovarian syndrome will have very long menstrual cycles. So they'll have more than 35 days between periods, sometimes lots and lots more days between periods. And then when they do have a period, oftentimes people with PCOS will have a very light period. And sometimes this is like literally that they don't even need a pad. They would just be able to get by using a panty liner for the duration of the period. So sometimes the flow is very light and sometimes their period is actually very short. So usually like 1 or 2 days or thereabout. Sometimes those very light periods are followed by a very heavy period. So if you have PCOS and you've had an irregular cycle, these long periods of time between your actual bleeds, and if you've been having very light bleeding for those periods, then you may have a period that is extremely heavy after that. And usually that's because the lining of the uterus gets so thick between the periods that you can experience very heavy bleeding. So sometimes people with PCOS will have normal periods, sometimes very light, sometimes those periods will be followed by very heavy bleeding. So that's the first kind of group of symptoms in PCOS. The second is related to abnormal hair growth. So with PCOS, what we see is that people will experience hair growth where they don't want hair growth. So this is a condition in a woman. And so facial hair, for example, is something that some people experience with PCOS. So they may experience abnormal or excess hair growth on the upper lip, on the chin area. They may experience abnormal hair growth on the chest, on the upper tummy. And the term for this is hirsutism. And it basically is referring to excess or unwanted hair growth, where typically women wouldn't usually experience hair growth. And usually this is also accompanied by hair loss on the top of the head. So very frustrating for people with PCOS, because not only do they lose the hair on their head, but they start to develop hair in other places where they don't want it. So typically in PCOS, the hair loss is kind of at the top of the head, and it's kind of like in this male pattern baldness. And really those two symptoms, so the hair loss on top of the head and the abnormal unwanted excess hair growth, are both symptoms of high levels of androgens. Now, androgens are a group of hormones in your body. You may be familiar with testosterone. Testosterone is a type of androgen. And basically it's the hormones in the female body that are kind of male typical hormones. And so when those male type hormones are in excess, so they're too high, then this unwanted excess hair growth and this hair loss on the top of the head typically tends to happen. And then the third kind of group of symptoms is actually not really a symptom, it's something that we observe when we do an ultrasound, is the cysts on the ovaries. So some people with PCOS, like we said, can have lots of what looks like cysts on the ovaries when we do an ultrasound. And like we said earlier, these are actually not cysts, they are immature follicles. And the reason why people with PCOS can develop this on the ovaries is because they're actually not ovulating effectively. So when we talk about the menstrual cycle, you'll see what I mean here. But essentially these are the three like broad categories of the PCOS, kind of how we diagnose PCOS and what we're really looking for in order to make the diagnosis of this syndrome. What's interesting is that there are different ways of diagnosing PCOS, and that there are different schools of thought about which type of diagnosis is better, but typically polycystic ovarian syndrome is generally a condition where you have high levels of androgen, so high levels of that male type hormone together with menstrual cycle irregularities. Typically, those are the two most important things that are usually required to be present when making this diagnosis. And that's the reason why some people don't have cysts on the ovaries, but they still have PCOS, because they can have irregular cycles and they have the excess androgens and the symptoms that are associated with that.